These are general instructions for oral surgery with sedation. General preparatory instructions. In general, following surgery, you will swell for 2 days, have that swelling settle in for 2 days, and then have that swelling leave the area for 2 days. So in general, your post-op recovery is about a 6 to 7 day period until you are resuming normal activities for the most part. No exercise until things are completely resolving, which is around 1 week from the day of surgery. As far as work or school, plan to take off the day of surgery and the day after as a minimum. The third and fourth day is dependent on your job activity level or degree of surgery. If you have a strenuous job or underwent and involves dental surgery, such as 4 impacted wisdom teeth, day 3 and 4 may need to be taken off in addition to days 1 and 2. As far as diet preparation in preparation for surgery, in general, you need to get foods that flow. In other words, pureed or uniform foods are preferred, such as applesauce, pudding, yogurt, or soup. You want to avoid foods with large pieces of solid food, such as soups with bits of celery or carrots, as an example. These foods will disrupt the healing. You also want to avoid anything harsh, such as excessively hot foods, and this includes both high temperature foods and spicy foods. So bland foods and average temperature foods are the best things to get in preparation for your surgery. Smoking, if you smoke either marijuana or tobacco, you want to avoid doing that where possible. Do this for as many weeks pre-op and post-op as possible, as smoking will inhibit healing. And specifically avoid marijuana use, including any edibles, at least 3 days prior to surgery, as this can cause complications with the sedation medication. Now to specific preoperative instructions. As far as your diet, please have no food or drink such as coffee or milk in your stomach at least 8 hours prior to your surgery. Water and water only is okay up to 2 hours prior. With regard to medications, preoperatively, such as if you are taking an anti-anxiety triazolam prior to coming in, a small sip of water can be used to take those as prescribed, which are typically at 45 minutes to 1 hour prior to surgery. As far as your escort, preoperatively, make sure you bring your escort to the office. This is someone who you trust who will make sure you get home okay. This person should remain in the office during the whole procedure. With regard to clothing, please wear something loose-fitting and short-sleeved so we can establish IV access easily. Closed-toed shoes or other secure shoes are preferred, since sandals or flip-flops will sometimes fall off. For post-operative specific instructions, your focus after surgery is protecting the blood clot that is forming in the extraction site. Bleeding is normal for the first day and can be minimized with pressure. Take an adequate amount of gauze, fold it up, and place it over the site that you believe to be bleeding and bite down firmly for 10 to 15 minutes. Pressure must be applied to the site in order for the bleeding to stop. If it's still bleeding after 10 to 15 minutes, reassess where you're putting the pressure and apply pressure again. If you are tired but are still bleeding a small amount, place a towel over your pillow to avoid getting any blood on hard to clean surfaces. If you'd like to lie down, keeping your head elevated to some degree will minimize bleeding. If you'd like to spit out any excess blood during the day, do not do so forcefully, as we are trying to preserve the blood clot and not dislodge it. Also, allowing any excess blood to passively flow out into a sink is better than regularly swallowing it, since the potassium in the blood can sometimes cause nausea when swallowed in large amounts. As far as post-operative eating, keeping things clean is your priority. Eat pureed soft foods as described, flowable foods such as applesauce and pudding. When you are finished eating, gently rinse with a warm saltwater rinse, roughly 1/2 teaspoon per 8 ounces of water. Again, perform gentle rinsing since we are trying to keep the site clean and not dislodge the clots as they heal, so you don't want to be too vigorous. On day 3, you may switch your rinse from the warm salt water to a chlorhexidine rinse if it was prescribed, usually in a brown bottle. This rinse has a small amount of alcohol in it as a preservative, so we do not want to use that too early on days 1 and 2, as the alcohol can disrupt the early clotting. Avoid sucking through a straw since the negative pressure can disrupt clotting. Drink plenty of water to stay hydrated during this healing period. With regard to brushing, you may brush your teeth normally, but again, avoid spitting forcefully afterward and try to avoid being too rough with the surgery site itself. As far as post-operative activity, use your ice packs 20 minutes on, 20 minutes off throughout the first 2 days during the swelling period. This will reduce blood flow to the area and help avoid prolonged tightness and stiffness during the following days 2 through 6. Keep activities to a minimum, especially during the first 4 days. No exercise for the first week. If you would like to use heat, 20 minutes on, 20 minutes off, use after the swelling is already established, which happens around day 4 through 6, in order to break up that swelling and get things moving again. Do not smoke during the healing period. As far as pain medication, use as directed, but in general, try using 1/4 to 1/2 tab of the narcotic pain medication to mitigate your pain. If pain persists, then you have the other 1/4 or 1/2 to take, but by doing so, you have taken the smallest amount of dose necessary to achieve the effect. This also helps avoid any side effects such as constipation or nausea. Ibuprofen is useful for minimizing swelling and should be taken regularly with food, otherwise it can cause an upset stomach if it's taken alone. The pain medication and the ibuprofen can be taken together or separately. They act differently and are metabolized differently. With regard to your antibiotic, start the antibiotic pills when you're awake enough to take medication. Use the antibiotic as prescribed from that point forward until they're gone. If a rash develops, please stop taking the medication and notify us. A low-dose Benadryl may be beneficial in the case of a rash. Lastly, with regard to any numbness or tingling, for lower tooth extractions, we usually use a long-acting local anesthetic which will last roughly 8 hours after surgery. Additional numbness or tingling may occur after surgery, but is likely to resolve with time given your specific risk factors. If numbness lasts beyond the anesthetic time frame, such as extending into that second day, please let us know. Thank you. Please do not hesitate to contact us if you have any questions. Your comfort is our priority.